Did you know that back pain is the second most common reason people go to the doctor? For today's Here's to Health, we're going to talk with the doctors of Integrated Physical Medicine of KC about their unique approach to this common complaint. You'll find Dr. Kendra Pearson in their Northland location and Dr. Sean Bennington at the Overland Park office. Welcome to the show.
It's good to be back.
Now, what are the common causes of back pain?
Wow, there are hundreds.
Yeah.
It literally could be anything from a tight muscle to a pinched nerve to a disc that's degenerating. But Kendra and my approach is somewhat different than the normal medical community. We want to understand why is the body breaking down? Why is that disc breaking down? Why is that nerve being pinched? And as we look at it, what we find most often, not always, but most often, is it's a structural problem. So what that means is it means there's some abnormality in our physical makeup, in our structure, that is causing that breakdown. So whether it's the back or the neck or the shoulder or whatever, it's a biomechanical issue. And so to put this in layman's terms, let's say you drive your car and you notice the wheels are rubbing or shaking. And you take it in and they say, oh, well, the axle's bent, but also the tires are showing lots of wear and tear. So if all we do is replace the tires, has that really fixed the problem? Of course not, because the axle is really the cause. So that's how we look at the body a little differently. We want to fix the axle and then tap on the tires as opposed to doing it the other way around.
When should folks make the decision to go and see a doctor? At what point, at what pain level should they go in?
Well, even with minor back pain, you should see a doctor. And I'm pretty passionate about this, just because with my experience, 10 years of practicing chiropractic medicine, I just see so many patients that have just minor low back pain, just a few times a year, and then they get a little episode of low back pain. They're like, I can deal with it, it's no issue, it'll go away after a while, or I take some ibuprofen and it goes away. Well, too many times I've seen these patients that have this minor low back pain, and all they do is just step wrong, bend wrong, and it blows. And now they have a herniated disc, now they're in the hospital, now they're off work, now they're having surgery. So even minor low back pain is your body's warning signal telling you that something is wrong. It's structural, that it's wear and tear on the spine, and it's like there's a time bomb waiting to go off in your spine. So you need to go to the doctor if you're experiencing even minor low back pain. Have it examined. If it's not a big deal, we'll tell you. If it is a big deal, we'll tell you.
And what are the solutions that your offices offer?
The cool thing about our office is there's so many options. We have integrated offices. What that means is we have everything from acupuncturists to massage therapists to medical doctors to chiropractors to physical therapists to rehab specialists to medical assistants to nurse practitioners. We have it all. And then with that, we can look at a patient and say, hey, this is what we think you truly need, and here's our team. And what we found is, even though these fields do great individually, when we put them together collectively, the results are phenomenal. It's unbelievable. It's the most fun I've ever had in practice.
Love that team approach to healthcare, no doubt about it. All right, well, thank you so much for joining us on this show. We appreciate it.
Our pleasure.
We'll see you next time.